Untangling Pandas and Pans is a podcast about two little-known medical disorders characterized by the sudden and dramatic onset of symptoms such as obsessions and compulsions, vocal or motor tics, and restricted eating behaviors, and a whole host of other symptoms following a strep or other bacterial or viral infection. I have the privilege of interviewing some of the top researchers and clinicians in this rapidly growing area, known by various names such as immune-mediated neuropsychiatric disorders, infection-associated neuroimmune disorders, and autoimmune encephalitis, or simply PANDAS and PANS. My name is Dr. Susan Manfull. I am a social psychologist, the executive director of the Alex Manfull Fund, and the mother of Alex Manfull, who died at 26 years old due to PANDAS, a disorder my husband and I knew next to nothing about, certainly not that our daughter could die from it.
This is Episode 3, Part 3 of Untangling Pandas and Pans, recorded May 13, 2024.
Welcome back to my conversation with Dr. Shannon Delaney. In Part 3, we will discuss the potential link between Bartonella and neuropsychiatric symptoms, including some soon-to-be-published findings from a study in which Dr. Delaney is the primary investigator. Can you tell us a little bit about the study that you have just completed and that we'll soon be able to read in more detail about the Bartonella species in adult psychosis?
Yeah, sure. So this study was done going back like the 10 years ago when I participated in this research fellowship. And I had the idea to recruit patients with psychosis and then look at different immune and infectious biomarkers that might be contributing to their psychosis. So at the time, there were a few different groups. So it was a pretty wide range. I think I recruited patients ages 8 to 35. So it was young, kids and younger adults. And I recruited patients with history of psychosis and did a standardized evaluation to make sure that they qualified for psychosis according to standardized measures. And then we had a healthy control group. So these are people who had no history of any psychosis. A lot of them were research assistants at Columbia at the time. And then the second group was an interesting in-between group. And these were patients with prodromal psychosis. So that means that they either had a family member who maybe had overt psychosis, or they were presenting with very mild symptoms of psychosis, but they still had completely intact insight. And so they didn't have the full departure from reality, just maybe minor, very early symptoms of psychosis. So I collected blood on all of these participants and we had good numbers. I think I had maybe more than 50 some in the psychosis group. I had, I think, around 20 in the prodromal group and then maybe 40 in the healthy control group. And these are just estimates. And I collected blood on all of these participants and then stored the blood in -80 freezers, and then obviously took a job at Columbia after I finished my research fellowship, so didn't have time to really go back to that research anymore. But in the meantime, I developed a lot of collaborations with colleagues who were in this area. So Dr. Ed Brightsworth is at North Carolina State. He's a vet by training, and he is a world famous Bartonella researcher. And so I've known him for many years and we've worked together on other projects. So I think I casually mentioned to him at some point, he did a couple of studies looking at patients with psychosis and Bartonella, but they were very small studies. And so I think I told him, hey, I have this whole cohort of patients. I have their blood and their serum stored from a few years ago. If you'd be interested in looking at Bartonella, that would be a cool study to do. So over a year ago, I think we sent him samples from the study, and just recently we got some exciting results. So what we found was that across the board, when you looked at the psychosis group compared to healthy controls, there was no statistical difference in the antibody positivity in the two groups. So what that meant was we saw a fair number of healthy controls, I don't have the exact numbers, who were antibody positive for Bartonella. So that means their immune system has seen the bacteria before and making antibodies towards it. No difference between groups in those with psychosis and the healthy controls.
Because you said in the control group, there was evidence of the antibodies for Bartonella?
There was.
Okay. Mm-hmm.
So no higher in the psychosis group.
Mm-hmm.
But then we went a step further and we just didn't look at antibodies, but we looked at, he did various invasive PCR testing. And what they do with that is they're actually looking for the bacteria itself. So they're doing genetic testing to see if the bacteria is present in the blood. And so we found a surprisingly high number of participants with adult psychosis who had Bartonella, evidence of Bartonella bacteria in their blood. I think it was 42%, which is a strikingly high number of people positive. And it was statistically significant compared to the healthy control group, which I think was maybe 17%. I should have those memorized, but I don't.
14%.
Oh, 14, even less.
Yeah. Probability equal to 0.021.
Yeah, so that's a good p-value.
Mm-hmm.
Interestingly, we also found a completely new, like one of the first cases of a different Bartonella strain. So there's a few different Bartonella strains that can cause human infection. And I think this might have been the first case of some obscure Bartonella that we found in one of the participants in the study. So I don't know what we'll do, if anything, to advance that knowledge, but it got us thinking, why is there so much Bartonella in the New York City area? Like, where is this Bartonella coming from? I mean, I talked about before that it can be present in ticks, but you can also see it in lice and fleas and house spiders. So it begs interesting questions.
Wow. Well, and then also the application is incredibly interesting. If someone's diagnosed with a psychotic disorder, let's test them for Bartonella.
Yes. In fact, that's a good segue to point to one of the, so there's a case, what led up to the study is Dr. Ed Brightsworth had done a couple of very small studies looking at patients with schizophrenia, not psychosis. For my study, I purposely broadened it to psychosis because sometimes, for example, when someone has bipolar disorder, they can have psychosis. So I wasn't only looking at patients with schizophrenia, but in his prior study, I think he had a small number of patients with schizophrenia. But he also published a very influential case report, which I'll just mention briefly because it really has changed the field and how we work up these cases as clinicians. This was a 14-year-old who had no significant prior medical psychiatric history, who developed significant symptoms of psychosis pretty all of a sudden. He was diagnosed with schizophrenia.
At 14?
14, I believe, which is pretty early onset. Diagnosing someone with schizophrenia, usually we would see that in the early 20s age range. But nonetheless, he was diagnosed with schizophrenia. For 2 years, he was in and out of psychiatric hospitals, put on a ton of antipsychotic medications, which is what we would use to treat schizophrenia if that's what it is, without an infectious trigger. Nothing got better. Things got worse. No improvement despite all of this treatment. And then, interestingly, I think somehow he made it to an integrated medicine clinic, and there was a nurse doing a physical evaluation on him, and they noticed these rashes, which are called striae. And if you look up Bartonella striae, you'll see they have a very characteristic look. They look like stretch marks.
Mm.
And the confusing piece is that they're often found in areas where people do have stretch marks. That being said, we see these and they're very prominent, even in thin people who aren't necessarily growing or whatever, but they can often be like very violent red or purplish color. And they're like very characteristic looking. So this particular nurse knew something about Bartonella, and she's like, I think this is Bartonella striae. So that's where it all started. Then from then on, somehow Dr. Ed Brightsworth, he got involved and they got to the appropriate doctors, and he was aggressively treated with multiple antibiotics to target Bartonella. And eventually his psychosis completely disappeared. I think also, don't quote me on it, but I think that they had taken in like a stray cat.
Mm.
So this kid's psychosis, ironically, was about the cat also.
Oh,
And then it turns out that the cat likely gave him the bacteria that caused this problem. So
unbelievable.
it's a pretty wild story. They've also written, it was scientifically published as a case report a few years ago. And then there was a narrative piece that was written about it in a magazine too. So it was pretty phenomenal. And even more importantly, after appropriate treatment, he got better, his psychosis resolved, he went back and became valedictorian of his graduating class. So it was like,
That's incredible. Oh my gosh.
that publication, that case report really got out there to the world that, okay, Bartonella can cause psychosis. This is so clear because this is what I see a lot clinically. Like they go down the psychiatric road, they're not getting better, they're getting worse. They get the appropriate diagnosis, they get the appropriate treatment, they get better. Granted, it doesn't always happen that way, I should add. Just because you have the appropriate diagnosis and the appropriate treatment, these diseases are really difficult to treat. So it's not as if just because you're on the right regimen, like things can get better, are going to get better like right away. That doesn't often happen. It can be a very long journey. But in this particular case, it did work. He did start getting better pretty quickly, even though it still took many, many, many months and they tried a bunch of different agents, but he eventually got better.
That's incredible. Well, Dr. Delaney, this talk has been so enlightening to me, and I know it will be for our listeners as well. Thank you so much for all your time and all this very interesting information that I hope inspires young people to go into your field. We certainly need them.
Well, thank you for having me, and I appreciate the nice words. And yes, I'm totally in agreement with that statement. We need a lot more doctors and scientists studying these things.
Well, I'm so glad that you're in this work, because I think that psychiatry and medicine in general really needs more people like you who are willing to take on these difficult cases and see them through. Thank you.
Thank you.
This concludes the third and final part of episode 3. Thank you for listening to Untangling Pandas and Pans. For more information about Pandas and Pans and the Alex Manful Fund, please visit thealexmanfulfund.org. The content in this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.